My name is Tawanna St. I am the cancer genetic counselor at Medical City Dallas Hospital, and I'd like to start out by saying it is an honor to be of service to current and previous breast cancer patients and their families. I wish you all the best, whether you are currently being treated, previously were treated, or are concerned you may have to be treated for breast cancer at some point in the future. As a genetic counselor, my primary role is to help identify patients who have or are at risk to having hereditary cancer. Approximately 10 to 15% of all breast cancer patients have a mutation in a gene that they were born with that put them, as well as their other family members, at risk to develop cancer. When a genetic counselor, like myself, identifies individuals and their families that are at risk to developing cancer due to a genetic mutation, then we can provide them and their physicians with guidelines specific to the mutation found. These guidelines aid in the prevention and/or early detection of cancers, whether being applied to patients who have never had a cancer but are at risk to it, or if being used for those currently being treated for cancer. Knowing whether you or a family member has a hereditary cancer gene mutation can help yourself and others in the family. More recently, in addition to prevention and early detection, by identifying patients who have certain genetic mutations that contributed to their cancer diagnosis, physicians can come up with a more personalized approach to the management and may even find a clinical trial specifically created for those who have these gene mutations. There are red flags that someone may have a hereditary cause to their breast cancer or is at risk to develop breast cancer because of a gene mutation in their family. These red flags include a patient with or close relative of a patient with breast cancer diagnosed under age 50, breast cancer diagnosed at any age with a limited or unknown family history, breast cancer diagnosed at any age with Ashkenazi Jewish ancestry, triple negative breast cancer diagnosed under age 60, multiple breast cancer diagnosis, multiple family members with breast cancer, male breast cancer, ovarian, pancreatic, or high-grade prostate cancer. Yes, I said prostate cancer. A family history of aggressive prostate cancer may be related to a family risk of breast cancer, just like a family history of pancreatic or ovarian cancer can indicate a gene mutation in the family. Often, a person with a pathogenic gene mutation is at a high risk to develop various cancers. For example, a person who has a problem with the BRCA gene, also called the BRCA gene, can have up to an 84% risk to develop breast cancer, and if they've already had breast cancer, a 20% risk of a second primary. Women with this mutation have a 25 to 63% risk to ovarian cancer, and men up to a 20% risk of prostate cancer. Men and women with the BRCA gene mutation may also be at risk or higher risk to pancreatic cancer and melanoma. All of these risks caused by one gene mutation. There are many other gene mutations that may increase breast cancer risk in a patient that are not BRCA genes. So if you've previously been tested just for BRCA, you may want to ask your physician for an update in testing. If a person has a mutation in any gene that increases cancer risk, their close relatives, siblings, parents, children each have a 50% chance to have the same thing. That is a lot to remember and go through, but don't fret, that is why genetic counselors exist. If you meet testing criteria or believe you might need it but are unsure, then a genetic counselor like myself can help you decide if genetic testing is right for you. Genetic counseling is covered by most insurances, and out-of-pocket payment is also an option. If you speak with a genetic counselor and are found to meet specific criteria for hereditary cancer genetic testing, then most insurance companies will cover that testing. A genetic counselor can help you figure out if you meet criteria for this testing. Overall, compared to receiving a cancer diagnosis, it is much easier for both you and your insurance companies to prevent cancer if able, or catch it as quickly as possible if unable to prevent it. Knowing if you have a gene mutation can help with this. And for those with breast cancer today, knowing your genetic status may help your physicians with your treatment and care. Many people meet criteria for genetic testing, but if you meet criteria but your insurance company will not cover your genetic testing, there are out-of-pocket options as low as $250. With the aid of patient assistant programs, many patients pay under $100 for testing. FSAs and HSAs can also be used to cover this testing. So do you and your family a solid. If you believe you or a family member has a hereditary cancer, or you'd rather just play it safe and check, please be sure to reach out to a genetic counselor.